Hello guys, I'm Dr. Amiri and today I'm going to record a video about reviewing a journal article. If you are a data scientist or medical doctor and you want to submit your article that is related to the field of AI in medicine, this video is yours. Now, uh, I want to talk about the questions. Before you want to submit your articles, you should ask yourself about your article. Is it qualified about these questions? And I've write the questions before. And one of my articles is ready to show you how we evaluate it. Okay. Uh, First question you should say, you should ask yourself, is the purpose of this study relevant for clinical practice? Sometimes I see articles that they are great, strong, fully strong about the AI and statistical methods, but they don't have any usage in the practice, so they aren't acceptable. The second question you should ask yourself is, does the evidence provided in the manuscript have an impact on clinical practice? The first question is about the related, and the second is deeper and ask you, does it have any impact? Sometimes it's just about the research, not about the practice. And the third question, are the formal study design, ethics, and informed consent sections complete? Uh, it is about the ethics. You never ever can use information of the patient without informed consent. Sometimes uh, you may spread the information of patients based on their medical information. And the fourth question is about the patient population adequately described. Uh, you should describe the population you used in your study in a way that another people can do it again without any difference than you. And the fifth question, is the patient selection process sufficiently described? For instance, sometimes you say, I use these cases from that hospital, 100 cases from that hospital, but this question is about if you are using the pneumonia x-rays, to say which x-ray, pneumonia x-rays you uh, consider and which them you don't consider them in your study, and why. Criteria of choose the uh, patient's studies and information. And the sixth question is a proper comparison of the investigative approach to the clinical standard of care performed. Since you are doing data science in AI research and solution, always we have a standard uh, solution in medicine before we have AI. So all studies should compare their results, their methods, and their way with the standard methods. Okay, the seventh question. Does the data acquisition describe provide all details to replicate it? It is somehow about the two prior questions. If you done them in a good way, the question is yes. And the eighth question, is the data collection analysis described in a way it is? And again, it is about the statistical methods. It's about the AI algorithms, your workflow that will after choose population, the patient, they should able to repeat your study in a technical way. And nine, I talk about it, statistics appropriately described and applied. And the 10, are the results present in an easy, understandable way? You should use the plots, figures, and tables to make the results more easy to understand for your reader. Remember, you write essays, articles for others, not for yours. You know what you did. And the 11th question is about have appropriate metrics of precision and statistical test result been described. For instance, when you do a data science study, you should talk about not only you should just report the accuracy. Accuracy alone is not uh, mm, have a good value. You should talk about F score, talk about precision, talk about recall, talk about negative value and false negatives, true negatives, and talk about all of them, not just some metrics that they are good in your study and others are out. Talk about uh, if you use k-fold, say about standard deviation in folds and all parts, external, multi-center. If you do a multi-center study about what the metrics in your external validation sets, internal validation sets, and all parts of your study. And about 12, have multivariant and machine learning methods been appropriately used? For instance, uh, should use the you should use the appropriate algorithm and methods for your study. If you have a 50 patient CT scan, you can't use neural network. Uh, of course, your study is right. So you should use a good methods based on your study limitations and your population. And about the 13th question, is the question concise and legible? Uh, maybe after your abstract, or maybe before your abstract, the discussion of your article is the most important parts of your article. Show why your why your research matters, why you did it. You should work on your discussion uh, more than all parts of your article. And about 14. Does the discussion objectively describe the relevance of the findings? You have a finding, you have a result. You should bold them, you should say why they matter, and the place you should explain them is in your discussion part of your study. And about 15, does the discussion appropriately cover the discussed prior literature? It's very important that if you don't know your prior studies, what they did, how you do the study, because of the fundamental of each study, you know your prior research in the field, the subject. After that, you see a gap and you fill it. If you don't know about your prior studies, you are in the wrong way, absolutely. And if you don't mention it, be sure that the reviewer absolutely check it and you can't ignore it. And about the 16, have limitation of the study been appropriate? And about the sixth question, have limitation of the study been appropriately addressed? Please be honest about your limitation, because uh, a reviewer, a third person out of your study can see and find limitations better than you. So it would be better you do it for other people find and mention your limitation, especially when a reviewer see you address your limitations in a fair and satisfied way. They like your article. They don't hate. They don't reject. But when they sense you want to beat them, uh, be sure they reject your article. At least they make a major revision on your article. And about the 17, should aspects of this article been reviewed by a dedicated specialist? Most of the times the reviewer says yes. For uh, more sure. And about the last question, 18, is the manuscript uh, structure, manuscript structure, text flow and writing appropriate, and not very weird, uh, and in less time you have a conflict part, because the articles have a specific parts, and it's not very tricky question. Thank you for your attention. If you want the questions, you can email me and I will send it to you. And I forgot them on my article, but you can do it on your article and they are very easy to understand. Thank you for your attention again. See you